Hi, Crystal. Great to see you again.
Hi, Rohit. Thanks for having me on the show.
Absolutely. So, thank you for joining us. As you might be aware, Crystal, the podcast itself or the show itself is called The Big Unlock. And it was started by Paddy Padmanabhan at Demo Consulting. And we are building on the foundation that he had laid. So we are up to, I think, in the vicinity of 150 plus podcasts at this point in time, season six. And it is great to have you here. I'm Rohit Mahajan. I'm the managing partner and CEO at Demo Consulting and Big Rio. And would you like to please introduce yourself to the audience?
Of course. Hi, everybody. I'm Crystal Broj. I'm the Chief Digital Transformation Officer at the Medical University of South Carolina. I'm based in Charleston, South Carolina, but our system spreads the entire state, all 46 counties of South Carolina. We are one of the oldest medical universities in the country. We're celebrating our 200th year this year, so we've
Nice.
been around a long time. We have
Congrats.
2.4 million patient encounters annually. We have 16 hospitals, about 2,700 licensed beds. But besides being a health system, we're
Mhm.
one of two national telehealth centers in the country,
Great.
recognized as centers of excellence. We also have a university with 6 colleges, about 884 residents and fellows, 42 degree programs that sit in those 6 colleges. We're the #1 rated hospital in South Carolina for a U.S. News and World Report. We're also a research organization, and we have about 300 million in research funding a year. We have 1,200 clinical trials, about 55 active startups. Um, so a lot of really exciting things here, and I'm just so blessed to be down here and adding some digital transformation to this and taking that in a bunch of different ways. Rohit, we've talked about this, some of the exciting things
Yes.
that I'm doing, and I think we're gonna hit on some of them.
Yeah,
Okay.
we are going to dive deep into that soon, Crystal. But before that, Crystal, please tell us like what interested you and attracted you in this space. How did you get started into healthcare? Tell us a little bit about your journey and where you are at and what you might be thinking about a little bit in the future as well.
So I started out as a COBOL programmer actually. When I came out of school, I was IT. And so I did COBOL and I did programming, and then I sort of jumped around a couple different jobs because back in the day, if you didn't jump, you die because you get stuck
Yeah,
in the system, right? So I moved around. I went into consulting, then I go back to big business. I go into consulting. So I did that for a while, and then I had 2 young children at home, and working 60 hours in consultant didn't work for me. So I took some time off. I actually got the opportunity to be a director of Christian education for a church for a couple of years. So
awesome.
totally different, more passion projects. So I don't have that normal IT struggle up. I've kind
Yeah,
of bounced around a little. Then I went back and I did some managing and stuff. And I've worked in all kinds of different industries, from manufacturing, health clubs, insurance, um,
great.
uh,
Yeah,
human resources companies. So I have a
yeah,
wide breadth. So I didn't grow up in healthcare. So
right.
when I got a job that I was actually the chief technology officer for the American Association of Diabetes Educators, so healthcare adjunct, right? Because we were
Yeah,
training diabetes educators to help patients. That was my first jump into true healthcare. And then COVID happened, and things changed, and I was out of work for a while. And I actually wrote children's books during COVID.
oh, wow.
Yeah, that's a fun fact. I saved it for now.
Yeah,
So
that's
I did
nice.
that, put him on Amazon. I probably made
Yeah,
$100, but it was fine because it was really fun and something for me to, I wrote him, I illustrated him. It was really fun. And then
great.
afterwards I went back and I, ran a business analyst office, and we started teaching people agile. And then I went to North Shore University Hospital System in Chicago, and I was their vice president for digital. And
Hmm.
I built a team up from scratch because they didn't have a digital team, and we built it up to have 8 people on that team, and we had some consulting services that helped us with that. And then my dream job happened to show up in Charleston, where I wasn't really looking, but my daughter was going to school here. She's getting her
Awesome.
doctorate here in nurse anesthesiology. She graduates next month. Um,
Great.
um, but so we started looking down here and be like, okay, well, we love Charleston, and this job came up, and I was like, this is my dream job. And so I
Yeah.
started as a team of one here. And we're very innovative. This whole organization really believes in innovation, and some of the things you'll see that we've done in the past 2.5 years is crazy. So I went from a team of one to now I have a team of 8
Wow.
in 2.5 years. And so that was really exciting. And I am blessed to work with some amazing people, not just my senior staff that supports the work that we do, and consistently wants like, what can we do next? What can we do next?
Yes.
But the staff that works for me puts their whole heart into everything they do. So, and it shows with the kind of success we have. When we roll out projects, they're rolled out really carefully. So, one of the things I say is we won't roll it out until it's good, because we get one chance to make a good first impression. And so
Yeah.
we don't toss something out that's like, well, we'll see. We make sure everybody knows what's going to happen, and we share that with them. So that's kind of how I got to where I am.
Great.
We started with a small project. We were using uh,
Mm-hmm.
uh Notable is the
Yeah.
company name, right?
Mhm.
You've heard of them, obviously.
Yes.
They're well known in the marketplace. We started with them doing a pre-engagement. So you have an appointment. I'm going to send you a note 3 days before saying, hey, the reminder, here's your appointment. Do you want to confirm it or cancel it? And then so we started that with just 5 offices.
Mm-hmm.
And just to see how it would go, we wanted people to try it. We wanted to get the offices ready for it. We wanted to see how patients would react to it.
Mm-hmm.
And so we started with a pilot in there, and then we started to grow it from there. And I think that was one of the biggest lessons learned is, yes, start small and then move forward. And so then we moved it to 100 offices, then 500 offices, and now it's at all of the offices in the organization. We send out those pre-reminders, we get cancellations and confirms back, and then we
Mm-hmm.
added in, oh, let's get all your demographic information validated. So we say, put in your
Right.
demographics. Then we pulled all the demographic information from Epic so that you could see it and just go, yeah, I still live in the same address. Yes, I'm still married, those kinds of things. So, all the things that the doctors need to know before you walk in the door. And then
Great.
we added on to that and said, okay, well, let's do bill pay, and you can pay your bill, your copay in advance, or if you have a
Mhm.
balance, we added that to it. So you can see
Yeah.
we added little pieces along the way. We didn't
Yeah.
try to make everything perfect, but the little pieces we did very small and very thoughtfully. And then we listened to patient feedback, because at the end of that experience, you can give it a thumbs up, thumbs down. And
Mm-hmm.
so patients would say thumbs up, and then they'd say, this was great, or this is this. And we
Mm-hmm.
get some thumbs down, and we read every single one from our customers. We make sure that we're touching the patients and find out what they want. And so with
Great.
that, we got things like, hey, I come to the doctor 3 times a week. Why are you sending me the same information all at once? And
Mm-hmm.
so we worked with the vendor, and we send one at the beginning of the week and say, you have 3 appointments this week. Here they are. Do you want to check in for all of them
Great.
now?
Awesome.
They put in all their information in advance, and
Yeah.
it's done. So they just go up to the front desk and say, hi, I'm Crystal, I'm here.
Okay. Okay.
Um, and then we put it in Spanish. So now
Okay.
if you speak Spanish,
Even
you will get
better.
it in Spanish, which is great. And we get all kinds of
Yeah.
comments from our Spanish speaking population that this is
Yeah.
easy. Thank you so much. I can do it from my home, all
Right.
that kind of stuff. So, really good success in there. But one thing that we learned,
Mm-hmm.
we started doing the change management. Our
Mm-hmm.
front desk staff are used to giving people a clipboard. And
Okay.
so as we rolled it out, we said, okay, well, they're going to check in on the phone.
Mm-hmm.
We would have people that are like, yeah, well, how do I know the system's really working? I
Mm-hmm.
still want them to fill out the clipboard. And
Mm-hmm.
like then patients would get frustrated. It's like, wait a minute, I did this online. And so
Mm-hmm.
we had to think about how the technology touches everybody. We had to retrain front desk staff to go, no, it's okay. Or we had a couple of glitches because nothing's ever perfect. And so
Yeah.
they're like, oh yeah, that didn't work. Don't use that. Just don't use it.
Right.
Come see me at the front desk. It's okay. And so, or we
Yeah.
get somebody new at the front desk who doesn't know what this is at all. They didn't go through the
Mm.
rollout, and so like they don't know, they don't care because they just have no knowledge of it. So we ended up creating training materials so that when new people come on board, they always get the training materials. They always get that. We make sure that we do the communications. But oh yeah, by the way, now your patients can get it in Spanish,
Yeah.
or this is something new that's happening, so that they can understand all the way through. So those were some great lessons learned for us. Like start small, make sure you communicate, over
Yeah.
communicate, and grow with the vendor to do something really great.
That's great to know, Crystal. Lot of great experience there in terms of scaling the solution. So, and I did read somewhere that you mentioned that innovation is in our DNA.
Yes.
So, could you talk to us about some more, any other of your digital transformation projects or innovation projects where you've had success, and I think you are very good at tracking metrics as well, is what I understood. So
Yeah.
how do you track those metrics and kind of look at the return on investment? So a lot of questions in there, but yeah, over
Sure.
to
I'm happy to go into a bunch of those
yeah,
things.
yeah,
Once we started with Notable doing that, then we started looking at how we could do other outreaches to
yeah,
patients.
yeah.
So, in COVID, people didn't go to the doctor, right? So women
Mm-hmm,
especially don't take care of themselves.
mm-hmm,
Went back to close a care gap for for mammograms, because most women didn't go during COVID and then they got busy and forgot about it. So we
Mm-hmm.
did outreach. If you haven't had a mammogram in a year, we send you a reminder saying, hey, we
Mm-hmm.
care about your health. You're overdue for a mammogram. Would you like to schedule it now? And
Mm-hmm.
they could automatically schedule it. You didn't have to call in. You didn't have to do anything. And we turned it on at 5 o'clock at night on a Thursday. And by the next morning, we had 129 women that had scheduled their mammograms. That's a
Wow.
KPI unto
Great.
itself,
Yeah.
right? And then we started
Yeah.
tracking those women to see, and by the time we really got, it's still in progress today. We do it
Yeah.
monthly, who hasn't gotten it in a year every month, and we send out these notifications. And up to date, I think we've had 1,800 mammograms that have been scheduled. And what we found is that about 180 of those women needed to come back because they had abnormal results.
Oh, wow. Okay.
So we
Yeah.
got them the care that they needed
Yes.
before it became too late.
Very timely. Yeah. Yeah.
That's where you are like, okay, this is digital, and yeah, there might be KPIs, but this KPIs, we can potentially be saving people's lives, and there's no
Yes.
dollar amount that you can put
Oh,
on
yeah.
that, right?
Absolutely. Absolutely. Yeah.
And so with that being very successful, then we started hitting up Wild Child to make sure people came in for their visits for their kids, getting the
Mm-hmm.
shots they need before school. So we send something out
Mm-hmm.
about that. We send
Mm-hmm.
notifications out about flu shots to remind people to come in and schedule for their flu shots. We're going to
Mm-hmm.
start doing uncontrolled hypertension and getting readings on
Mm-hmm.
that so people can do it. Diabetes as well. So start checking on that. So we're just continuing to build on that platform,
Mm-hmm. Yeah.
and get those kinds of things. We know that we have sent out since June last year 1.7 million reminders to our patients. And
Wow.
and then knowing that, we've got about 50,000 cancellations that have happened, but that seems like a lot of canceled appointments. But at the same time,
Yeah.
if you cancel
They
and
do
someone's
happen.
not showing up,
Yeah.
the doctor can refill it. And we have an
Yeah.
automated way to do that through Epic. It's called FastPass. So you can, get somebody else in. That helps with access, because then people can get in sooner,
Right.
helps doctor schedules, makes everything flow better for both patients and providers, which is really what transformation should do, right? We don't ever want to burden providers. We want to make things easier. We want things easier for patients as well. Um,
Right.
with Notable, I mean, I can't
Mm.
say enough about it. We have a 98% satisfaction rate from our patients, and that's
Okay.
another
Yeah.
KPI that we track. And so we just started with a new product with Notable, where we're actually doing with revenue cycle, we're doing prior
Mm-hmm.
authorizations.
Mm-hmm.
And,
Mm-hmm.
we all know that, you might get a referral for a MRI, but you have to wait for your insurance company to say it's okay before you get it, and make
Mm-hmm.
sure they'll pay for it, all that kind of stuff. Well, to do that, somebody has to take your referral,
Mm-hmm.
type it in Epic, and then go to the payer site and type in all the information again,
Yeah.
and play back
Mm-hmm.
and forth with the payer, and then put it back into Epic. That can
Mm-hmm.
take anywhere from 15 to 30 minutes.
Mm-hmm.
Well,
Mm-hmm.
we have an automated AI agent that does that now, and they
Mm.
can do it in about 30 seconds. So if
Wow.
you think about how much faster that is for the back of the house, that
Yeah.
number alone, but much quicker patients can get in, and
Mm-hmm.
tracking how many are automatically approved right away. And we have about a 37% accuracy on this agent, and it keeps learning all the time.
Mm.
So that means almost 40% of the ones that we send through are done, and the human doesn't have to touch it. That's
Mm.
amazing. So coming up next, we will then go, okay, Rohit, you've been approved. Here's a link, schedule. That's
Yeah.
where we're going next with that, right? So those are some things that we're doing.
Great.
Successful with that really helped our senior staff know that, this is a team that can take big things on, and do it well. And
Mm-hmm.
so we brought a voice bot into our patient access center.
Mm-hmm.
We have 42 phone lines, about 150 people that answer phones every day. And if you've
Mm.
ever called a access center and you press one for this, press two for this,
Mm-hmm.
and you wait
Mm-hmm.
on hold for gosh knows how long,
Oh, yeah. Mm-hmm.
we've got an automated natural language processing agent. We call her Emily,
Mm.
and she answers the phone. Hi, I'm Emily, your digital assistant. How can I help you? This
Cool.
is, well, I'm checking on my appointment. Okay, give me some information to validate who you are. It goes into Epic. Goes, yes, Crystal, I see that you have an appointment next Tuesday and next Friday. Which one do you want to know about? Oh, the
Mm.
one with Dr. E. Okay, sure. That's 2 o'clock next Tuesday. Do you want to confirm, cancel it, or do you need to reschedule? Actually,
Mm.
that's great. I just needed to know where to park.
Mm.
It, and she can do all of that, and it doesn't have to take up an agent's time.
Wow.
Is
Yeah.
amazing. So we
Yes.
deflect, and that's another thing we track. We deflect about 17% of the calls that come into the patient access center.
Yeah.
then, we're not getting rid of jobs. Don't think that by any means, but that means that our patient access reps can handle a
Yeah.
more complex appointment
More
with a
complex
deeper
calls. Yeah.
question, something that's harder to do, that our hold times have gone down, our people that get frustrated and just hang up has gone down.
Yeah.
So those are the types of things that we track to prove that the software, these digital tools, are doing what we really want them to do.
That's really interesting implementation. So the handoff between Emily and the real live agent is seamless.
Yep. We
Okay.
go, okay, I can't help you with that. Let me connect you with
Yeah.
someone who can. The
Oh,
other thing about
that's
Emily is she can answer the phones 24/7. Our
yeah,
access
that's true.
center is only open, I don't know, 8 to 5 or whatever. So she can
Yeah.
answer after hours and answer questions. And maybe sometimes it's a more complex thing. Sorry, I
Yeah.
can't do that. Can I, have you call back to talk to an agent tomorrow? Just say talk to
Sure.
agent when you call, kind of thing, right? And we
Right.
are
Right.
just now changing it so that she can reschedule, because rescheduling is much harder than just scheduling. Um,
Yes.
and within the next month, she'll speak Spanish too.
That's
So,
great. Yeah.
but that comes with another thing where we really had to train the
Yeah.
bot, right? So
Sure.
it has to learn accents. We're in the South. I come from Chicago, so I don't sound like I'm Southern except when I say y'all. But that we had to train it so it would understand the accents, it would understand certain words, understand that appointment may mean visit, may mean something else,
Mm-hmm.
and do that training of the model and
Mm-hmm.
take the time to do that. So testing is really important. Really
Yes.
going through and testing and validating that to make sure that it works. Getting the people that are going to use the software to use it so they understand what are patients hearing, so that when it comes to me, I'll know that,
Mm-hmm.
oh, Emily already asked this and this, and I'll have some of that information for me, things like that.
Yeah.
Um,
Yeah.
but it's wildly successful, all 42 lines on it. Now we're going to roll it out to the rest of the state, because right now
Okay.
it's just in Charleston. We're going to roll it out for our revenue cycle. We're going to roll it out for our pharmacy
Yeah.
so that we can take some work off the back of the house. So again, they can work at a higher level of license, whatever that license is, so that
Yeah.
we're taking that gross stuff, that things that we just want to get out, stupid stuff, and then start to do, those higher level things that
Yeah.
provide more value to both our system as well as our patients.
That's great. That's great, Crystal. So I heard you say, I think early on in our conversation, maybe even before the podcast started, that you did look at a lot of KPIs, and you have a certain way of looking at return on investment, and there are certain benchmarks that you kind of track. So could you tell us a little bit more about that, please?
Well, some of it is, how many patient encounters, or, financial impact.
Yeah.
We know that we've collected with that pre-experience copays. We've collected about $1.4 million in copays through the technology. Doesn't have to touch a person, doesn't have to do anything else.
Yeah.
Patients, so front desk people, they don't like to have to ask you for money, right? But if you get that ahead of time, or you get a reminder afterwards, then you
Yeah.
do it with your credit card, boom, done.
Yeah.
Balances, if you have an open balance, it collects that. We've collected about $1.9 million in open balances.
Hmm.
So, and just tracking, for voice, how many calls are deflected, how many are actually done, how much money,
Hmm.
how much time are we saving in labor? A phone call can last 3 to 5 minutes. Well, if that person doesn't have to do that, they can be more productive doing something else.
Yeah.
So those are some of the things, how well is the bot doing? How many calls does it pick up? How many referrals can
Hmm.
it handle? How many authorizations can it handle? Those types of things, and being able to show that to, both our users as well as senior management, to be able to say,
Hmm.
we're going to hit these things, so therefore these are things that we can do.
Great.
That's
Great.
the kind of stuff. And we produce a report monthly
Yeah.
for our stakeholders, both the business leaders as well as our senior staff, to go, this is how many appointments we scheduled, this is how many of these we
Right.
did, how many of these we did, so they can really see, the impact that technology is having on the system, and what value it brings, and why we do that. We just launched a new
Hmm.
software last week for our scheduling. If anybody goes to our website, muschealth.org, and they click on Find a Doctor, they'll see our new Find a Doctor interface. We use a product called DexCare. And
Hmm.
on there you can see the doctors. You can search by, do you want primary care, ortho,
Hmm.
whatever. But you can also use natural language processing and say, oh, I have an elbow strain, and it'll
Hmm.
pull up orthopedics, and it will show the first available, and it will
Hmm.
show the times for new patients as well as returning visits.
Hmm.
Pulls it straight from Epic and displays it right there. So we're totally transparent with the appointment slots that we have now, which we
Yeah.
really think is going to provide better access for our patients. With
Yeah.
that, in the past week, we've had over 200 appointments scheduled on our website.
Yeah.
which is fabulous. We haven't
Yes.
advertised it. We haven't done anything. People have just found it on their own. And, we're getting, people that are scheduling, they're very satisfied. Um,
Mm-hmm.
and I think that's just amazing. And so we're rolling it out again, very small. We started with primary care. We're rolling out specialties tomorrow. We're starting with ortho tomorrow. And then every couple of weeks, we'll roll out some new specialties with that. So we expect a good gain on that as well. Just being transparent. Our patients everywhere across the country are asking for access.
Yes.
With that, then they can see, when can I see a doctor?
Yeah.
Or the other thing that we're doing for people that are looking, it's like, oh, I have a cold, and then
Yeah.
primary care. But we also
Yeah.
surface up, by the way, we have virtual care. You want an
Yeah.
appointment now, click here, and they can do a
Yeah.
virtual care visit, which people don't know about. I mean, they thought about it
Yeah.
during COVID, right? Oh yeah, I
Yeah.
go to the doctor, I'm going to do virtual care. But now we can do virtual care, like just show, yeah, by the way, this appointment could be virtual care, and start offloading that, because there aren't enough doctors that have this many hours during the day that can see you. And if your kid's sick at 7 o'clock at night, you still want
Yeah.
to get some sort of validation of what you should do next.
Makes
As a
sense.
busy
Makes sense.
mom and having gone through that, to be able to do that and know what I could do, that's an
Mhm.
important piece as well.
That's awesome. So, what are some of the challenges, Crystal, like you go about implementing all these solutions? What are some of the big challenges that are being faced by people who are implementing these solutions?
I think across the country, we're short staffed.
Mhm.
Our IT departments are short staffed. So,
Mm.
they're busy keeping the lights on, and they do an amazing job making sure
Yeah.
Epic, Workday, and all those things are working and going.
Yeah.
Plus, all the technology from the laptop I have to the, network and all that kind of
Yeah.
stuff they have to handle as well. So, they're doing that. And then they're busy full time. It's not like they're sitting around, right? And then
Mhm.
here comes digital transformation, and they have a new toy that they want to have, right? And they want to put it in, and it's like, it's not like I can go do that on my own. Like,
Yeah.
I'll do all the work around it, but eventually
Yeah.
tie into a main system.
Yeah.
So then it's, sharing with IT why this is important, what we're trying to
Mm.
do, and getting on their schedule so that they can connect me to a cadence analyst or an API analyst to,
Yeah.
get it cooked up together. But it's not like the projects they've done in the past. If you do an upgrade for a major system, on
Mm.
June 30th, I'm gonna, implement the system. So 30
Mm.
days before I should be done with testing, and 30 days before I should do something else. When you
Mhm.
start using these new technologies, like I said, you start small, 5
Mm.
offices. So, okay, I need a connection for the 5 offices. Then I'm going to go in 2 months to 100 offices. Well, then I need a new report that gives me those 100 offices. And then 6 weeks later, I need another report added on for these many things. So I'm like the gift that keeps on giving to IT, which
Yeah.
does not always make me popular. And
Yeah.
yet, we found a way to kind of work together, and we're still working out some of the fine tuning on that to make it really sing, because it's hard for them to figure out what does digital transformation need now, right?
Yeah.
An API person, the vendors will tell me, oh, this is easy. It's 4 hours, you'll be done.
Yeah.
Yeah, 4 hours to get the connection going. And then you know what? When it doesn't work, I've got to get called so you can talk to my analyst to go, why doesn't
Yeah.
this work? Can you help me troubleshoot? And that's
True.
it. They can't
True.
plan for that, right? And so we don't know. Well, we might have problems, but they say they won't, but we probably will. So let's see if we
Yeah.
can figure out, let you know that this might happen. But there's no way I can predict what the problem's going to be or how many hours I'm going to need. And that makes it
Yeah.
hard. I think a lot of people are struggling with that across the country. And that whole agile concept of we're gonna do
Yes.
little, we're gonna add more, it's never done.
Yeah.
Makes it hard to budget resources. My
Hmm.
team's just constantly churning through it, but IT's got like a whole other job to keep the lights on.
Yeah.
And that's a whole
Yeah.
different, so
Yeah.
that's a little bit of a challenge. And then working with, our user side or business side, we're
Hmm.
changing the way they do things. And
Yes.
change is hard. And so there's a lot of change management. Why are we doing it? What's in it for me? Why should I do this?
Hmm.
And some people resist that. We're using ambient technology as well here.
Yeah.
We're out with a pilot of 125 doctors that are using nuanced stacks, and they're
Hmm.
talking in their phones and saying, okay, Rohit, I'm the doctor, you're my
Yeah.
patient.
Yeah.
So let's, this is going to record my notes.
Yeah.
So if you're okay with that, and we always ask. And
Sure.
so we press play,
Yeah.
and then you and I talk, and like we did before, we were talking about my daughter's graduation, we're talking about other stuff, and then I'm going to ask you about, I don't know, maybe you have asthma or something else. I'm going to talk to you about that. I'm going to talk about the medications, how it's working, how it's not, and then tell your dog I said hi, tell whatever, and all that
Mm-hmm.
gets translated into the note.
Mm-hmm.
Except the stuff about my kid, about your vacation, about your
Yeah.
dog isn't there. It just takes the medical stuff, which is
Yeah.
still amazing to me that AI can do
Yeah.
that. And then, you can say yes, no, or adjust stuff, because there's
Yes.
always human that are just checking the AI, because it's an
Yeah.
assistant, it's not, an independent body. And
You're
then you
right.
pick that, and it's that. Well, it saved 37% of pajama time for doctors,
Yeah.
which is crazy good,
Huge.
right? And
Yeah.
it also closes charts faster, so revenue cycle
Yeah.
is really happy about that. But when we did our pilot, not every doctor loved it.
Yeah.
You're like, and of course they don't want to look dumb in front of their patients. So if they
Yeah.
aren't comfortable with it, they're not going to use it. And so there are a lot of things that we learned from that, okay, we have to find out what the sweet spot is. How do we communicate? We wrote great emails, the most beautiful emails in the world. Dr. Crystal, here, this is what you need to know. And here's some information, blah, blah, blah. And we'd send them out. The doctors don't read it. They don't
Yeah.
have time. So,
Yeah.
they weren't responding. They weren't asking questions. They just stopped using the software. So we had to
Mm.
figure out ways to either text them or have somebody in their office, ask them how it's going. And some
Mm-hmm.
doctors just didn't take to it right away. So then
Mm-hmm.
we gave it to somebody who wanted it.
Mm. Mm.
Overall, the
Yeah.
amount of time savings and closing charts faster and doing those kind of things to give doctor satisfaction at the
Yeah.
end of the year was great. It was so great that we're giving an enterprise license. We have 600 doctors waiting to get the technology,
Awesome.
which we're
Awesome.
going to start rolling out this spring. So,
Awesome.
that's the KPIs were important to show
Yeah.
that this really was valid in
Right.
the pilot to what there was a go no go, and if it wasn't working, we
Yeah.
weren't going to use it. But we showed that it did work, and so then we can add on to something else.
That's great initiatives, Crystal. So as we are coming now to kind of close of the podcast, I would like to ask you for, what do you see when you look into the future? What is your peek into the future? And any other closing remarks or thoughts that you would like to share with the audience, Crystal?
Yeah,
Yeah.
I think we're going to see more and more AI, but I don't think we'll ever see AI taking over our jobs, right?
Mm-hmm.
I think
Mm-hmm.
we're going to have to find some sort of a sweet spot where
Yeah.
integration becomes easier between our main systems and these
Mm-hmm.
add-on systems. I
Yes.
think go away from like if you go to any show, you see, oh, there's this for, I don't know, brain cancer, let's say. There's this for heart, there's this for this,
Yeah.
and there's whatever, and you know what, I can't afford to buy this and this,
Yeah.
nor
Yeah.
can I integrate those,
Yeah.
and do that kind of stuff. So we have to have something that can kind of do everything at least
Yes.
somewhat well, but we can customize and make it so that it's better for the whole system.
Yes.
I think we'll see more of that coming along than
Yeah.
the spot solutions. Not that they're not great ideas, but
Yeah.
I can't afford to do it. I don't know many hospital systems that can take on
Yes.
that many things.
Right.
um, I think we'll see more in uh, patient navigation. And I don't mean wayfinding per se, but I mean like, I
Mhm.
know I'm going to have to go in for an ortho appointment. So you're going to
Yeah.
do some education before that. I'll be able to maybe answer my questions through two-way text or something
Right.
beforehand. I'll get stuff a day before or 3 days before.
Mhm.
Maybe my husband, who's going to support me, will get something as well.
Mhm.
And then I'll come in. Maybe there's something in the hospital that does some education or whatever. And then when I'm discharged, I will
Yeah.
get follow-ups both from a nurse. Maybe it's text first. And then if I have
Yeah.
a question, a nurse will call me back. Maybe I'll
Mhm.
get some more education. And then all of that will be seamless to me as the patient. It's just
Mhm.
like, it may be point solutions along the way, but for me, it's
Yeah.
just seamless. It's my hospital system caring about me. It's my hospital system showing me the way to go, those kinds of
Yeah.
things. I think we'll see a lot of that, more of that coming out as we get better at using the tools that are at our disposal.
Great. Great. So great conversation, Crystal. Thank you so much for being here with us today. Really appreciate it. And I will now close the podcast.
Thank you so much for having me. This was really fun.
Absolutely. Likewise. So just stop.